Hello, my name is Patrik, and today I'll be discussing COVID-19's impact on the Veteran Health Administration's use of telehealth services within GI liver clinics. Trends among VA liver clinics indicate that there are high rates of utilization in clinics that are often under-resourced, and there are limited telehealth services available. These trends ultimately reduce access to care. Telehealth offers one potential valuable source of access. Access reduces mortality, admission rates, cost, and improves quality of life. Telehealth may also help overcome travel barriers, socioeconomic determinants, and most recently, COVID-19 restrictions. To further investigate this relationship, our team identified 4 study aims. First, to collect VA provider perceptions, to investigate specialized liver care, to explore telehealth's feasibility and acceptability, and lastly, to identify changes at respective sites due to COVID-19. Using qualitative interview analysis, our team discovered several overarching themes, including the adoption of telehealth services by sites, the associated successes and challenges of its use, and perceptions regarding the future use of telehealth. Prior to COVID-19, telehealth services were limited. 10 out of 23 providers interviewed did not use telehealth, and it was predominantly used for education and training. It was also usually used for specific conditions, such as patients who were undergoing liver transplant. We found that in response to COVID-19, most sites did adopt telehealth services. These visits mostly occurred via telephone, but some sites had adopted video as well. One challenge that existed both prior to and during COVID-19 was the use of certain technologies. In many cases, it was unavailable or difficult to use. One nurse practitioner stated that there hasn't been access to many VA computer laptops, and I think that connecting into the remote system, that makes it even worse. Many of the interviewed providers expressed concern that in addition to providing adequate medical care, they were forced to become IT specialists as well. During COVID-19, telehealth was deemed useful by many of the interviewed providers. One GI doctor suggests that a lot of patients could really benefit from just having either a telephone call check-in or a telephone clinical visit. While in-person clinical visits are delayed, telehealth has the potential to be a supplementary tool for liver providers. Moving forward, recommendations for the future use of telehealth focus on the VA computer infrastructure. One provider suggests that it's not just telehealth, but the system underlying it. The federal government really needs to put a lot more resources into that part. COVID-19 exposed many of the VA's underlying deficiencies, and the federal government must respond if telehealth is to be successful. The implications of this project include strengthening the argument that insurance should cover telehealth services, expanding telehealth services to consistently include video consults, increasing the acceptability, feasibility, and necessity of telehealth services, and improving healthcare for veterans through future research and training. Thank you all for attending. I would like to thank the study PI, Dr. Marina Serper, Aniza, the studies project manager, my capstone professors, and to all of you again for being with us today.